Hello. Hi, Annie. Sparrow.
Hi, David. Great to see you.
Great to see you. We just heard from Dr. Tedros, but we had some more questions that came for us from teachers around the world who are following the broadcast. And we're just really, really honored to have you with us, not just as a friend of EI, but as a global expert in your own right who has vast experience and knowledge and someone we're really eager to talk to. So we had 3 questions that we picked that sort of floated up to the top in terms of what our members, what teachers really want to know. One of them has to do with your previous experience of health emergencies and outbreaks such as Ebola, and sort of what's the difference this time around?
Well, and thank you, because it is a pleasure to be here. And I think this is just one of the most important things that we could, the most important thing that we could be discussing right now. I think that what we have learned from previous pandemics is that we haven't really learned enough. But what COVID has shown us is that foundational to everything else is our health. We can't get anything done without it. But as part of that, education is absolutely critical. And what we have done with COVID is we have had this sort of blunt response. We've shut down everything out of a combination of complacency, fear, denial, and then panic. And then you have this complete shutdown. And part of that is also, of course, because China was slow to actually acknowledge that there was respiratory transmission. It covered up all the health workers who are actually been infected. There's this, and it sort of inferred this focus on hand hygiene, which means that we didn't actually think about, respiratory airborne transmission. And that's led us down this path of then shutting down schools, because we know that schools are hotspots for influenza. But playing COVID by the influenza playbook doesn't work, because it's a different disease. And we can see that very clearly. And so in shutting down schools, we have done, we have actually, it's a man-made sort of catastrophic, we have created this. And I say this as a doctor, where our first sort of precept is meant to be first do no harm. Hippocrates did say that, but not in terms of clinical medicine. He said that in terms of diseases and epidemics. And he said, do something useful and look to the future about what you will do, but first do no harm. And what we have done, of course, is created enormous harm by shutting down the schools and spawned these parallel pandemics in child marriage, child labor. Tens of millions of girls are probably never going to come back. We have, we're seeing this enormously, the increase in mental health issues, anxiety and depression and eating disorders and suicide. And some of these are very well documented already in places like Australia. And of course, physical health, kids are becoming more obese. And, so there's a whole sort of a range of physical, mental, emotional, social issues. And all of those are addressed at school. And here's the thing that I think now we can see how absolutely essential teachers are and schools are, because education is on paper, is the third most important determinant of health. But in reality, it's the single most important, because the others being income and whether you have a job. How do you achieve that? With education. With every year of education, you have it has a knock-on effect and increases your life expectancy. It increases your health at every level. It means you are much more likely to get a job, and you are going to be protected with that educational attainment for the rest of your life. It can't ever be taken away from you. But that's what we have done now. So the teachers are absolutely critical in actually, because we can't do anything about the poverty. We can't do anything about the unemployment. We can do something about education, and we need to actually, get that going as soon as possible, because we have not only left, up nearly 1 billion kids, sort of stranded, as it were, and so many of them are already disadvantaged, and we know that. But we know that now how absolutely essential teachers are to actually kickstarting and reopening not only our societies now, but our futures, our economies, our ability to withstand the next pandemic. So we need to be really smart about this one. And in terms of the other things we've learned the importance of trust. And it doesn't even matter, like when our vaccines come out, we must protect our teachers as part of that front line. Teachers are primarily getting infected in the communities, not in schools, but they need to be protected because they are on the front line, and we see how important they are. But vaccines don't work by themselves. It's the vaccination. And how do you generate the trust? that has to be, that's done by the teachers. We trust our teachers in the same way that we trust our churches and our doctors. I mean, they are a fundamental community resource because they're vocational. They're in it because they love, what they do, and they're doing it for that reason. So they don't have, their primary agenda is, as Dr. Tedros just said, that we are in it for the kids, and their kids are our common ground. They're our future. They're our best hope for a future and our best reason for doing so. And schools are the real sort of literal common ground where that happens, and which provides the physical protection and the connectivity and the place in which we can actually really, sort of build back better. And yeah, anyway, that's probably enough of a response.
Yeah, no, it's a great response. It's a great response, Annie. And we've talked about this so many times. And one of the things that teachers are now writing to us about and writing to you about is that they feel sort of kind of in the middle, because obviously they're worried about their students. Obviously they're seeing the child marriage, the health, all those types of issues, and they want to do the right thing, but yet they're also worried about their own children, people of certain age or illness in their own homes, and they're sort of pressed there between their sort of professional obligations and their personal, rights. And so one of the things they're talking about is a lot of the facts that they're not getting the information they need. They're not getting the support that they need from governments, and sort of clearly making sure that they have those things that you were so clearly laying out that they need to be able to be protected. So talk a little bit just in terms of, if they're going to be frontline workers and they're going to be trusted in building the trust, what do you think needs to be assured for them as frontline workers with rights, so that they can be protected and also be part of the solution, and not just sort of as a pawn in a game, but actually, what kind of recommendations would you make?
Well, the fundamental thing about pandemics and that we have learned so clearly is that all of this focus on biomedical solutions. And by the way, I think we have really reached the end of this. I mean, we focus on vaccines and we focus on treatments as if that were the be all and end all, but that subordinates people to the disease. And we've really reached the end of that model. So now we have to actually return to a people-focused model. And the reason why that's so important is that we've seen this in other epidemics. With Ebola, for example, in Eastern Congo, we had the vaccines right from the beginning, first epidemic ever. We also had the treatments within months, actually. Did we have the trust? No. And trust comes from, at this stage in particular, at this era, where everything is so heavily politicized. Will you trust, Trump? Will you trust necessarily your government? What has to happen is that dialogue. And we saw this with HIV. Like, if we wanted to, if we wanted to protect the truckies or highly mobile populations, they needed to hear that message from, their unions, because they could trust them, for example. So we have to have dialogue between governments and teachers and all of the, and the parents and the members of civil society and all of those who are involved in this, because that's the only way to generate this trust and transparency that allows this to go forward. So whether we're talking about uptake of vaccines or how to protect, it's not just, of course, the classrooms and the schools, but it's the public transport systems, or how you actually get to school, and how do you actually make the whole community safe. There's an enormous gap in policy and in funding around this issue, and that needs to be addressed too. We need to actually have policies about how you're going to fund, how we're going to build schools back better, so we put in a school nurse and everything. So we build in ability to test so that, you can discern the difference between strep throat and COVID, or malaria and COVID. And as Dr. Tedros pointed out, we need to, they are already places of nutrition, but they could, schools all over the world are trusted community resources. So let's take advantage of that, and let's take advantage of the teachers who are right there and they know how to protect their kids. So let's listen to them too. And that is an extraordinarily important conversation. Fantastic.
Thank you. So you're basically setting us up. You're saying take the lead, exactly what we're trying to do with this conversation. You're telling us to keep doing this, doing more. And actually, we have another panel, which is going to take this even further. So for all of you, follow Annie on Twitter. Follow Dr. Tedros on Twitter. We'll continue the conversation with her, with EI, and I'm going to turn it back over to Christiane Chevalier. Thank you very much, Annie.
Pleasure. Thank you.